Hello everyone, my name is Amol Nirgudkar. I'm the CEO of Patient Prism, and we're here on day 2 live at Patient Prism Studios at the Dykema DSO industry event. It's been a wonderful 2 days with lots of DSOs out here, industry partners, vendors, companies that are really making a big impact on dentistry. One of the companies out there that is making already a big impact in the dental world is Overjet. And it's like our sister company. Sister as in they're in the AI business, we're in the AI business, and Wardah and I just had a great talk on a panel. So thank you, Dykema, for having us really promote the cause of AI and what it means for the DSO industry. Wardah Inam, you're the CEO of Overjet. Welcome to the program.
Thank you, Amol, and it was great being on the panel with you.
It really was, and obviously, I'm not as educated in AI as you are. I just got into the business by accident. I thought it would be a great use case to solve what we were trying to solve because we were seeing a problem that, oh my God, only 50% of these conversations are resulting in success. And we said, okay, what if we could understand what those problems were and fix it? So we ended up, engaging smart people in figuring out how to do this through trial and error. Eventually, we got to a point where we got very successful at that. You started the journey completely differently. Obviously, your background is pretty stellar. There's not many people in the world with your background. Tell us, first of all, your work at MIT as it relates to AI.
Yeah, so I've been in, of course, building technology for some time. I did my master's and PhD at MIT and was more focused on, again, for me, it is about solving problems. How do we use technology to solve problems that matter? And here, patient care, patient experience, the oral health of patients is a problem that we need to help improve. And AI is just a tool to help us improve that. And it's just a technology that can help us do that. My background has been in building these technologies. After my PhD, I did a postdoctoral fellowship as well at the Computer Science and Artificial Intelligence Lab, working on biomedical sensing using machine learning, have worked on biomedical imaging. So background in AI, biomedical imaging, and healthcare in general. Previously, before that, I was also working on AI and clean energy. So I have worked on different fields, but for me, it is about how do we bring impact and how do we solve problems that impact people's lives. And this is something that I feel very passionate about, of trying to improve oral health for everyone using technology. And the good thing is the technology is right. Now is the right time to utilize this technology as well.
Dentistry is so underutilized worldwide, but even if we talk about America, it's severely underutilized, right? 50% at best of Americans have seen a dentist, so 50% have not seen. Of the 50% who have seen a dentist, only 50% of them have actually accepted treatment. And I don't even know of the people who have accepted treatment that everything has been diagnosed. So if this is a $100 billion industry, if we even diagnose 10% better, if we got 10% higher case acceptance, we're talking about billions of dollars, right? Yeah. And better health too. It's not just about money, obviously. Why we're in the business, what motivates at least me in this business is that we're allowing technology to get people in the door, to get the dentistry they deserve so they can improve their lives, right?
Absolutely.
Obviously, what you're doing is even more significant in the space of that. So the question first is, a lot of people say, my God, case acceptance is a big problem in dentistry, right? And yes, it's a problem. But even if we go back 2 steps, I think diagnosis is also a big issue. Because if you look at a bell curve of, if you had all these dentists and look at a particular treatment modality, let's say a crown, you will see diagnosis rates from here all the way to here. Okay? What is the reason for that, do you think?
The way I look at it is a dentist, if you look at it, let's take radiologists. Yeah. Radiologists are sitting in their dark room, looking at these images, and that's what they're focused on, trying to diagnose. And even with that, you have some inaccuracies that happen, mistreatments, or misdiagnosis that happens. But now you look at the dentist environment, or in a practice, the dentist is doing an operation. They're sitting in somebody's mouth on a live patient. They're doing an operation. Yeah. A hygienist calls them, they have to get up from that operation, walk into another room, meet a new patient, look at what's present or the information that's been collected, diagnose on the x-ray within a few minutes,
Right.
convey that information to the patient in such a way that the patient not only understands, they have no idea about their oral cavity, they have to understand it and then accept the treatments. It's a huge task. It's a huge burden. We just take it for granted the way it's just being done. But the burden we're putting on dentists is a huge responsibility as well. And this is where I feel that technology can help, whether it is in helping them make that diagnosis or helping them convey that information to the patient. Because again, it's a very busy environment, very, very little amount of time, and a lot of context switching going on as well while they're doing this job. And this can really help them highlight all the information in front of them to look at more comprehensive care, right? Like they absolutely will notice a large cavity and they will help
Right.
solve that issue. But there is a lot of other things that might be going on in the oral cavity as well. And being able to take a look at the comprehensive view, all the things being highlighted as they walk into the operatory, and then using that technology, those visualizations that are automatically presented to communicate better with the patient is, I think, a game changer for the provider, but definitely for the patient experience as well.
So you're saying because of context switching, because they're moving from one operatory to another operatory, because there's lack of time, do you think there is lack of adequate training in radiology for dentists to be able to, yes, everybody can diagnose a big thing, right? But there are things that need to be diagnosed that if they progress in disease, could get to bigger problems. I mean, right now, if you fix the problem now, it's cheaper, it's faster, it's a lot easier. But as disease progresses, the next time you come 6 months later, that could have progressed to a much worse, more expensive, plus much worse condition.
No, that's absolutely true. Especially in dentistry, it is about doing the right treatments at the right time. If you do not do the treatment, it's not good for the patient at all. Like these treatments all get more severe, more expensive, more hurt you more as well. So it's not good. So in general, so it is about doing the right treatment at the right time. In terms of how trained the dentists are to be providing that diagnosis, I think there is definitely an opportunity here. We are working with dental schools as well to help them equip the dentists in making this diagnosis as well. Because again, a dentist is not only a radiologist, they're also a surgeon, they're also the office manager, they have to know so much. There's no, in the 4 years that they're getting trained, there's, you need better training that's happening as well. How many diagnostic courses are they going through? Very, very little, one, if any, and that's even more focused on x-rays and how you take x-rays, but really giving them feedback on what you're good at, what you're not good at, whether, you're diagnosing a particular disease at a certain time, you're not diagnosing it at this time. When you look at X, you miss Y. The fact that feedback loop that you have in other, like if you're coming from computer science, you get that feedback loop on your programs, they're not working, etc., and you learn from that, you learn from your peers, and when your code gets peer reviewed, etc. And that kind of feedback is also very, very helpful now, because it is about not competing with each other, but being the best dentist you can be, knowing where you need more help. Nobody's perfect. The best dentists in the world aren't perfect. It's a person coming right out of school, or the person who who has 30 years of experience. Nobody's perfect, but now the technology can help them in getting them at least highlighting the right things for them, and then they are the final decision makers. And the good thing is dentists are in this to help patients. That's why this is not the most easy job to be taking, but we need technology to be help support them as well.
So the question is, have you seen any pushback from clinicians on, oh my goodness, Overjet's really over-diagnosing something. I don't see it, but they see it. Are you seeing pushback from that, or are you seeing them that, hey, you know what, maybe I didn't see this and I should have? Is it hurting their feelings a little bit, or no? I'm just curious.
Yeah, no. So I was in radiology before, so
Right.
working with MRI images. When you're talking about AI in radiology, That's what a radiologist does, right? Their job is to diagnose on X-rays, etc. So there is more egos get involved, and that's what they're, because that's, and the computers are really good at doing it. When it comes to dentistry, if you ask dentists, are they a radiologist or are they a surgeon? Most likely, they're going to pick their surgeon.
That's right.
They're operating they're doing like thousands of procedures. There's so much that they learn and the procedures that they do working on these live patients, etc. And that's how they look at themselves. But diagnosis is extremely important. That's how you determine what treatments are necessary, etc. And that burden is also on them to be able to diagnose as well. And this is where I would say hygienists come into play, where when a dentist walks into the operatory, the hygienist has collected the information for the dentist. They're also highlighting it. Dr. So-and-so, I noticed X on X tooth number. I noticed. So they're pointing where the dentist needs to look at. So they're bringing that information to them. What this technology does is do that job. The technology is taking that information, highlighting it for the patient. So when the dentist walks in, all the information is there for them, and then they're making the diagnosis. If they do not agree with the recommendation, they do not have to accept it. This is a clinician assistance tool rather than a diagnostic tool. They're the final decision maker. So we've seen dentists looking at it in that way of this technology, helping them make the best decisions. And of course, they can make decisions without it, but they'll make better decisions with it.
So how effective is Overjet's AI technology in diagnosing better? I mean, you said earlier in our panel that it is almost better than what dentists are doing. Is that the case?
Yeah, so we have surpassed dentist level accuracy in most of the findings that we have, and we're talking about again a single dentist level accuracy. We have seen more X-rays than a dentist has seen in their lives as well. So there is a reason for it. Right. We also have trained it based on consensus, many dentists input, and that that gives us that advantage here. But the way we perform these experiments, etc., is through clinical testing, and that is through like the FDA's framework on how do you do assisted and unassisted reads with AI in a setting which you can actually show whether how dentists perform with the technology, without the technology itself versus the ground truth. So there's a lot of data that's collected in developing these technologies, and for us the more important piece is that we got our first product, Overjet Dental Assist, cleared from the FDA.
Yeah.
That's the first and only dental AI clearance currently, and it's an exciting opportunity for everyone in the dental industry right now, because this has been recognized as a software, as a medical device now, and we can actually utilize it to help dentists make better diagnosis as well. And to give you a little additional information on that, and how we did it was we gave we compared the technology not only with the ground truth, but also the dentist utilizing the technology and them getting better with using the technology as well.
So tell me, if I'm a dental practice, let's say I'm just solo dental practice, at the DSO level, the same thing applies just on a larger scale. And I have 1,000 active patients, and I have their radiographs somewhere stored in my system. And let's say I get Overjet installed, whatever it's probably as a service, it's no install. The process is I take all my radiographs and upload them into your system, right? And then what does it spit out?
Yeah, so that's a really good question. So we have a utility that gets installed on the practice software. We connect to the practice management system. We connect to the imaging software. We take that data, and first we're taking a read of all the data that you mentioned is present in that practice. We use our models start to run automatically, start to detect what's present. We're also looking at not only the X-rays, but also the transactional history, the appointments, what has been treatment plan, and then we're seeing, hey, compared to what the diagnostic data that's present and compared to what's happening, is there any disconnect? Are there disease present which have not been transacted before, treated before, treatment plan before? Can we highlight that? And so what you get when after you've installed it, all your practice data gets analyzed, every chart of every patient, of every provider, and we give you a complete picture of your practice performance. How are you doing on, say, periodontal disease? How are you doing on scaling and root planing? How are you doing on crowns? How are you doing on implants? How are you doing on the different treatments that you might be doing? Are there any opportunities here? Is there any risk here as well? So we look at risk and opportunities as well and highlight that in front of the patient and, in front of the dentist. And now the goal is, how do we make you move those metrics, right? Now you know what the practice is doing, right. And that is something that every practice we've entered into, people have experienced something or gotten more information that they never knew that never knew that existed in a way, in a positive way, as well as in a way that they can improve on. So things, areas that they're really doing well, they might even not know that they're doing so well compared to everybody else, right. Or areas that they need improvement on, and we can highlight those. And then the way we can uncover that information, provide, I think you mentioned actionable insights, right. Provide insights or actionable insights to the dental staff to capture those opportunities and put that in that daily workflow, such that those opportunities get captured, the right care gets delivered, the right revenue gets uncovered as well.
Are you telling that, oh my God, you miss $1 million in root canals? Or are you kind of able to
Absolutely.
quantify that?
Yeah.
Looking at their UCR and looking at all they've done to say, by the way, and then they have to do the hard part of, okay, let's reactivate these guys, or when they come in next. You don't want to just say, by the way, we got Overjet, this amazing system. Looks like we missed all these things. That's not what they're saying, right?
Yeah, no. So we actually, our dental staff. That's what you've seen. We have a lot of clinicians on the team, and that's what the clinicians do. They help you move those metrics in the right direction. It's not just a software that just installed and then you're left on your own to, you have, say, 1,000 root canals that need to be done, but we actually help the staff to capture those opportunities and make sure that you're trending in the right direction.
What financial impact are you guys looking at that? Like you guys have on an average practice by going in? That's a mature practice. What kind of top line impact do you guys generally have, or is it something that you don't measure?
No. So we do measure. It's like. Say, on $1 million revenue practice, there's hundreds of thousands of, dollars worth of revenue. But the way we look at it is about finding the right treatments, etc. as well, and having that information being provided. And it is about providing the right care, and revenue just follows.
Obviously, I'm not saying in terms of like, oh my God, how much money are we making? But obviously, when you diagnose properly, when you get these people in, revenue is going to obviously result by putting patient in the right health. Is it affordable?
Absolutely. So I think and I think dentists or dental DSOs know this really well. It's about the ROI, right? Is there an ROI here? There's no question about it. We're talking about 20x the ROI here. So definitely, we price it per practice per month and I don't think price has been any issue for us right now.
Right. So as you go along, what's next? I mean, obviously you've done a great amount of work in the insurance world, and my phone rings too all the time.
Sorry.
You're good. You've done a great amount of work with the top 5 of the 10 payers and that has really allowed you deeper insight into claims and billing. What are you doing from a claim administration standpoint, or submitting the claims? How are you helping dental practices with insurance?
So right now, I would say we're just getting started on that process. We've been working with practices, and we've been working with insurance companies, and now we're trying to connect them together, such that first they're speaking the same language. They're making sure that the medically necessary treatments get paid out and the non-medically necessary treatments get highlighted before. What we're trying to enable here is point of care predetermination. So while the patient is in the chair, being able to get a predetermination, being able to look through the criterias, and us making an automatic real-time decision on whether the claim will be paid out or not. And if the decision is it needs a further review, it might go through that review. But for most cases, we do not need to go through these EOB long processes, etc., which is administrative cost on the provider side, administrative cost on the insurance side, and we can use technology and automation to help solve that.
So are you actually using some natural language processing to go through that?
We actually use natural language processing in general because we look at notes, we look at other texts that people have provided as well. So we do use natural language processing.
This is fascinating. So you're helping, so to summarize, you're helping these dental offices diagnose better. You're helping them based on the diagnosis, you're giving them, these guys, the confidence to present better. Psychologically, the patient's going to accept a treatment that's also being verified by a data-driven source that's not, that's not really, sometimes people think, oh my God, this dentist wants to buy a Mercedes or whatever. Sometimes people feel, right, these doctors are just telling me all the things I don't need. So that's helping case acceptance. You're helping by detecting hygiene issues, which pretty much lead into all sorts of dental problems. As you said, the rate of detection of periodontal disease is dismal. Let alone that, and all people are doing is just, okay, every 6 months they do a prophy and all that's done. So really it's comprehensively changing the way dental offices function and really at the end of the day, delivering better health to patients on a daily basis. And the side effect of that is better top line growth, better bottom line growth. And it's fascinating. I'm really excited to see where this goes eventually into other areas of dentistry, in pediatrics. I know you're working in pediatrics and orthodontics as well, because there's so much opportunity. There's a lot of actually work being done in the space. I don't know how far it has been, especially in the ortho world. Dental monitoring is doing some work. I know you guys are doing some work to help them as well, in terms of how do we why can't the same technology help plan orthodontic treatment?
Absolutely, and I think the way we look at it is it's going to fundamentally transform how you run, grow, and buy practices. It's a game changer technology, and we are definitely right there. And when you talk about patient experience, again, bringing it, making it patient-centric, making it patient-focused, making the patient informed, and helping them accept the treatments that are needed, that they medically need, and that should get done. So it is something that, that helps the patients, helps the providers, and helps the payers. And, a few times in our lifetime do we get to work on technologies like that bring the trifecta together here and make sure that we are doing the best and improving oral health for everyone.
It is fascinating, Wardah. I'm so glad we had the opportunity to collaborate here, and I look forward to continuing our conversations as we keep doing more work in this space. I'm fascinated by what you do, and I think it's going to make, you're right, it is a game changer, especially with what you're doing. What we're doing is a very small part of really improving patient acquisition. Obviously that's a big industry, there's more dollars being spent in dentistry to acquire patients. But what you're fundamentally doing is solving so many problems using computer vision and NLP as well to diagnose, to get more people into health. It could be the most transformative technology in dentistry.
Absolutely.
So excited to see where this goes, and we'll obviously be in touch. So thank you so much for this interview, and I'm delighted and honored to be
Very nice meeting you.
to do this with you.
Awesome. Thank you so much.
Thanks.
Thank you.